What is stomach cancer surveillance for high-risk individuals? Imagine catching a problem early before it becomes serious. That's the goal of stomach cancer surveillance for those at high risk. For people with increased chances of developing stomach cancer, regular checkups are essential. These checkups mainly involve a procedure called upper endoscopy, where a flexible tube with a tiny camera is gently inserted through the mouth to look inside the esophagus, stomach, and the beginning of the small intestine. During this exam, doctors take small tissue samples, called biopsies, from different parts of the stomach to look for signs of early changes that might lead to cancer. These changes include conditions like intestinal metaplasia, which is a precancerous state, or early-stage cancer itself. High-risk individuals include those with genetic conditions such as Lynch syndrome or hereditary, diffuse gastric cancer, which are inherited disorders that increase their risk. People with a family history of stomach cancer, especially if relatives were diagnosed at a young age, are also considered high risk. Others include those who have had part of their stomach removed before, or who suffer from chronic stomach conditions like atrophic gastritis or pernicious anemia. People living in regions where stomach cancer is common are also more likely to need surveillance. The timing for starting these checkups depends on the specific risk factors. For example, someone with Lynch syndrome might begin surveillance around age 30, while others with family history might start earlier. The main tool for surveillance is the upper endoscopy. During this procedure, doctors look for signs of precancerous conditions like intestinal metaplasia or dysplasia, which is abnormal cell growth that can turn into cancer if left untreated. They also check for Helicobacter pylori, a bacteria linked to stomach cancer, which can be treated with antibiotics to lower risk. If early cancer is found, it can often be treated successfully with minimally invasive procedures. The interval between these endoscopies varies based on individual risk factors and findings. Some people might need an endoscopy every 1 to 3 years, especially if they have more advanced precancerous changes. For those with very high risk, such as Lynch syndrome patients, surveillance might be recommended every 2 to 3 years, or even annually in some cases. High-definition white light endoscopy is preferred for better visualization, and sometimes other screening methods are combined, especially in people with hereditary cancer syndromes. While the procedure is generally safe, it does carry some small risks, like bleeding or a rare chance of perforation, but these are uncommon. The benefit of catching early changes usually outweighs these risks. It's important to remember that ongoing research continues to evaluate how effective surveillance is at improving survival and whether it is cost-effective for different groups. In summary, stomach cancer surveillance for high-risk individuals involves a carefully planned schedule of upper endoscopies with biopsies to detect early signs of disease. This approach helps identify precancerous changes or early cancer when treatment is most effective. It is a vital part of managing risk and reducing the burden of stomach cancer in those most vulnerable. Always consult healthcare professionals experienced in gastric cancer risk management to determine the best plan tailored to individual needs.